Okay, everyone, welcome back. In this very last video, we're going to talk about the different layers of the skin. So when we look at the skin, we'll see the top portion is called the epidermis, right? That's this section here. And it's really made up of 5 microscopic layers compared to the dermis, which is really made up of the papillary layer and the reticular layer. The papillary layer looks like it's the top 20%, and then the reticular layer is like that lower 80% of the dermis. But there's lots of stuff happening here in the dermis, right? I mean, it looks like we got some blood vessels here. It looks like we got some muscle here. We got some nerve tissue here. And then down at the subcutaneous or the hypodermis, we also have blood vessels and we've got adipose or fat cells here. So we got lots happening. When we look at the epidermis, there's going to be 5 layers, microscopic layers. Each layer has the term stratum in it. So we have a stratum corneum, a stratum lucidum, stratum granulosum, spinosum, and germinativum. Sometimes the stratum germinativum is called the stratum basal layer. So sometimes they can be interchangeable terms because they're so close, those two. And a little mnemonic to help you remember the 5 layers from superficial to deep is Cher loves getting skin Botox. Cher loves getting skin Botox. So the stratum corneum, which is that upper layer, if you look at it, what type of cells do you think make up that stratum corneum? It's multiple layers. It's probably 25 to 30 layers of stratified squamous cells. Okay, they're flat, irregular cells, different than what's down here. So this is um, stratified squamous epithelium in that stratum corneum. Each layer is a little bit different. The stratum lucidum, this layer is only found in the parts of the body where you have thicker skin. You're only going to see it in the palms of the hand and the soles of the feet. All right. Then after that, the other thing I wanted to point out was in that basal layer or in the stratum germinativum, the germinative layer is made up of stem cells. So these cells move upward from the basement layer, from the basal layer or the germinativum, the stem cell layer, all the way up. It's going to take about 4 weeks to get there. And after 4 weeks, you can see they slough off. They slough off and die. And then, like the commercial, the Doritos commercial, don't worry, we'll make more. It makes more and it pushes them up to the top. Okay. Lots of keratinocytes in the skin. It's the main type of cell. They're called keratinocytes that make up the skin. And what gives it its pigment is the melanocyte. In the word melanocyte is mela, which means black. So as the UV rays come down, those UV rays are going to hit the melanocyte. The melanocyte pushes out melanin, which creates a black substance to protect the blood vessels in your DNA from damage. And then look, way down at the bottom, now we're into the dermis down here. These are called dermal papilla. And in here, these are called dermal ridges. These dermal papilla are really important. They're involved in creating the fingerprint, the unique fingerprint that we all have. So I've seen this pop up, which again is just labeling the Cher loves getting skin Botox from superficial to deep. That's the epidermis, those 5 layers. And once you're deep to it, then we're in the dermis. So make sure you know these, the stratum corneum, lucidum, granulosum, spinosum, and the basal layer. If you don't see basal layer, you will see stratum germinativum. So what do we see up here? Highlighted area, top portion. It's 5 layers. That's going to be the epidermis. What do we see down here? That's your dermis. And if I go back, and I do want to go back for a second here, the skin is made up of all four types of tissues. The epidermis, we've got epithelial tissue up here. We know the stratum corneum is stratified squamous epithelium. Okay, then we have connective tissue. Connective tissue is made up of a bunch of cells, and they are far apart from one another. Okay, one of the types of connective tissue, we had fat, that's connective tissue. What else do we have here? Oh, we've got muscle. That's the erector pili. Notice the shaft of the hair, the erector pili pulls on the shaft of the hair and makes the hair stand on end, giving the person goosebumps. We have glands. Epithelium again. We have sebaceous gland. That's your oil gland. We have tactile corpuscle. We have a lamellated or Pacinian corpuscle. This is neurological stuff. So now we have nerve, we have muscle, we have epithelium, we have connective tissue, we have blood vessels here. We have all four types of connective tissue: epithelium, connective, muscle, and nerve. The lamellated or Pacinian corpuscle, which is here, that's for deep pressure, whereas the tactile up here, that's for like light touch. Okay. And we also have sweat glands. This is called a sudiferous gland. Here is a sweat gland, and here's the sweat gland, and here's the sweat duct and pore. So that helps to cool off the body temperature. Okay, let's go back. So here is the hypo. So we have the epidermis, dermis, and then down at the bottom is the hypodermis or subcutaneous. This layer here, this is going to be the stratum corneum. Top layer, stratum corneum. Once we're deep, so we have share, loves, lucidum, that's the stratum lucidum. Share, loves, getting, skin, Botox. So now we have this highlighted area down here, that's the basement, that's the basal layer, stratum basal. The granular layer, the granulosum has granules and it releases some lipids, right? Releases some fats into the skin to kind of keep it some moist, okay? Here, these little hills that we see here, this is the part of the dermal layer. It's the dermal papilla that's involved in giving the fingerprint. All of these are dermal papilla. The nails, finish up. Nails have a few different parts to it. This is the free edge of the nail body, which is usually pinkish or reddish because you can see blood vessels underneath. We have the lunula, which is supposed to be clear and much lighter. And then you have the imponcium or the cuticle and the nail root. Behind the nail root is going to be the matrix, which is a bunch of cells that act as like the basal layer of the skin, and it's going to push the nail forward, much like pushing the skin upwards to sloughing off at the stratum corneum. So when we look at the finger from the side view, here is the free edge of the nail that's dead that you can clip. Here's the nail body. Okay, here's the nail bed, which is the skin below the nail plate. Here's the lunula. Here's the imponcium or the cuticle. Here's the nail root. Everything starts at the root, but this portion here, proximal to that, is called the nail matrix. That's the epithelium proximal to the nail root that contains the dividing cells to produce new nail. And that's why if you ever damaged your cell, damage these cells like a hammer hit it or a door closed on it, eventually this will fall off. Could take 7, 8, 9 months, and then new nail forms. And that could take, again, a few more months to grow outward. Right here, this highlighted portion, this is the nail body. And then this portion here that is showing, that's the nail root. Nail matrix would be over here, proximal to that. And the nails are really important. We use it as part of the physical exam. Whenever we look at people, I shake their hand. I evaluate the strength of the hand for protein evaluation. And then I turn their hand around and I look at the nails and I look at the shape. When we start to see it thicken at the cuticle and this becomes really thick and round downward, we call it clubbing of the nails. We see this when there's poor oxygenation found with lung cancers. We also see clubbing of the nails with irritable bowel syndrome or irritable bowel disease. And we'll see it not just with digestive problems, but smokers, people with emphysema, lung cancer, poor oxygenation. This is what it looks like here. So we'll see it with inflammatory bowel disease, cardiovascular disease, lung disease. We'll even see it with acquired immune deficiency syndrome, which is AIDS. You see how thick the cuticles are, and then how they just round down. The opposite of that would be spoon nails. We see that with severe diabetics where it spoons upward. And each of these means something. I mean, we could pick up thyroid problems with the nails. We could pick up cancer in the nails. We could pick up if someone's chronically ill or on chemotherapy from the nails. We can pick up anemia, right? If the nail bed looks white and pale, we're thinking maybe there's a B12 pernicious anemia, or maybe there is an iron deficiency anemia, or there's severe lung problems or cardiovascular issues, right? Like a congestive heart failure or even anemia, just poor nutrition and even liver disease. The nails give us a wealth of information. Here, now we're looking at cancer. This was one of my patients. Um, and this is called some ungual melanoma, right? So skin cancer just doesn't affect the skin. It can actually affect the nails. We can see this in darker skin individuals as well, not just light skin individuals. In fact, I picked this up twice, once in a light-skinned individual, and then a second time in an American African individual. Okay, so it just doesn't happen in light-skinned people, skin cancer. Then we could see things like this. These are called ridges. Looks like candle wax dripping. We could see this in some endocrine issues like diabetes mellitus, some thyroid issues, another endocrine issue called Addison's disease. We see it with B vitamin deficiency, malnourishment, even chronic stress.